Hey guys, it has been 40 days since my surgery and here's my report. You know, one of the challenges of leg lengthening is that unlike a typical surgery where the farther you get from the day of surgery, the better you get, in leg lengthening, during the lengthening phase, the farther you get from the surgery, the worse you get, or the pain gets weirder. You know, the more you stretch, the stiffer you get. More you lengthen, the stiffer you get. So people who are close to you, your friends, relatives, or other people who know that you had some kind of surgery on your legs, they ask you week after week, how are you doing? And the most frustrating part is that, you know, culturally you're inclined to say that you're doing good, but the truth is that the week after week you're actually doing bad. And this continues until you lengthen, and when you're done lengthening in the consolidation phase, that's when week after week you start to get better and better and better. And that's the most frustrating part, that when you're talking to others and they ask you every time they meet you, how are you doing? And you incline to say better, because if you say, well, worse than before, then something must be really wrong. So, all right, let's start. Pain. Well, pain is manageable. As you know that I had slowed down by 0.25 millimeter per day. Since then, it has been better. Pain management is going okay. Stretching. So I have been stretching every day as much as I can. I'm also doing hip flexes. And I do these twice a day, 2 sets each for 30 seconds each. So these has been going on. And then walking. Whenever I am walking, I'm paying extra attention that I'm not walking on my tippy toes, and that I am putting my heels first. So I'm trying to improve my walking gait. Scarring. Scarring is still good. I'm not concerned the way it has healed. Now keep in mind that my skin is darker than most of you, and I have hair on my legs, so that can hide my scars. If you're really fair skinned, I would be worried how these scars would come out. So overall, I'm still in pretty good spirits, still quite happy. Medication wise, I'm still taking pain medications. I do take Oxycontin for when my pain gets unbearable. So no problems there. In other news that I want to share with you is this week will be the first time since surgery I will be going into my office physically. So my job is such that I can work from home, but we are required to at least report to office twice a month. So this will be my first time going into office. So I'm a little bit excited, a little bit nervous on how that will go, but I will record a video and let you guys know how that goes. So stay tuned.